Well, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center, and we're coming to you from Chicago, Illinois at ASCO 2024. We're here with Dr. Jhanelle Gray, Head of Thoracic Oncology at Moffitt, also a newly minted ASCO board member. So Congratulations on that, Jhanelle.
Thank you so much. Very excited. I'm going to be starting officially tomorrow at noon for my service on the board, and we've had a really outstanding introduction from the board, getting onboarded, and just look so forward and so honored to work with ASCO and with Moffitt Cancer Center.
Great. So tell us what's exciting you right now in the lung cancer world.
We are really excited about the lorlatinib data that was presented on Friday in our oral metastatic session, and those curves look absolutely amazing. Obviously, in the plenary session, we also have two presentations in the plenary, both having to do with chemotherapy and radiation in locally advanced early stage lung cancer and small cell lung cancer. And they then subsequently give patients either an immunotherapy or they give patients a targeted therapy. And I will say, when you look at Dr. Schuchter's presidential theme from this year, the art and science of cancer care, this is really where we start to converge. You know what? At Moffitt, we developed the Pacific study, which was really the basis for these two studies that are now in the plenary. So this is where science that we are doing at Moffitt is informing, not just within our catchment area, not just within our state, but globally. So it's really exciting.
Great. Well, tell us more about this study.
Yeah. So one of the studies is called LAURA study. It is looking at locally advanced non-small cell lung cancer, those patients who get concurrent chemotherapy and radiation, and if they harbor an EGFR mutation, they then get randomized to surveillance versus osimertinib. And the press release looks very exciting. We will find out later today in the plenary session the official results of that study from 1 to 4 p.m. today. The other study is called ADRIATIC. Now, this study looked at patients with limited stage small cell lung cancer who also received concurrent chemotherapy and radiation therapy, and randomized patients to durvalumab, which is an anti-PD-L1 antibody, versus, again, an observation. And when we look at the results from that press release, we can see that it sounds very promising. And again, very excited for the results for both of these studies. They're really going to impact and change this field.
Well, we recently had an FDA approval for small cell lung cancer.
Yes.
And your team was the first in the country to put a patient on this FDA-approved agent, right?
Yes, absolutely. And so lots of months of hard work, and want to thank our thoracic team as well as our hematology, malignant hematology team for all of their partnership to get this up and running. So the drug is tarlatamab. It targets DLL3, which is expressed on majority of small cell lung cancer cells. And this is a study that was done also at Moffitt, and we participated in it. And I think that really helped us be primed to get the patients ready to be treated. We have everything set up for them to be treated also, not just at Moffitt, but in a safe fashion on our inpatient hematology service. And if you have any questions at all, please don't hesitate to contact us, and let's see where we can really help to drive the field forward.
Well, it's an exciting world. Really hope to continue to bring those death rates down in lung cancer, both small cell, non-small cell.
Agreed. So, couldn't agree with you more.
Thanks so much for being with us. Dr. Jhanelle Gray, lung cancer expert at Moffitt Cancer Center and ASCO board member.
Yes, thank you so much for having me.